my name is Tessa. I'll be your nurse today. I'll be doing a general survey and assessment of your head and neck. Do you have any questions about that?
No, ma'am.
Okay, we're gonna start off with a couple of questions. Can you state your name and age?
My name is Skylar Swallow and I'm 21.
Okay, and do you know who the current president is?
Joe Biden,
And do you know who the past president was?
Donald Trump.
Okay, and do you have access to 3 meals a day?
Yes, ma'am.
Okay, and I checked your BMI and it's right on track with your height and age and your gender. You look very well dressed. Whenever you walked in, I noticed that your gait was straight, no wobbling or stumbling. Do you use any type of assistive device, cane, walker at home? Okay. How's your mood? You seem pretty happy.
Yeah, most for.
Okay. Your posture is great. You don't seem to be slumping or shrugging. Okay, so I'm gonna wash my hands and then we'll get started on your head assessment.
Okay.
That's good. Okay, so first I'm going to check your scalp. No infestations or lacerations. Is there any pain when I move around? Okay, move this one here. Your eyes are straight and symmetrical. Your eyebrows are symmetrical. I don't see any redness, drainage, or swelling. Can you close your eyes for me? Okay. Your nose is symmetrical. I also don't notice any redness, drainage, or swelling, and your lips are nice and moist and pink. Okay, I'm gonna check your sinuses. This is your frontal sinus. And this is your maxillary sinus. Any pain or discomfort with that? Okay, so I'm gonna go ahead and check your trachea. Straight and midline. Any pain or discomfort? All right, and we'll go ahead and check your ears. Any pain or discomfort when I do that? No redness, swelling, or drainage. Any discomfort on that one? Okay, I'm gonna move you over here and we are going to check your lymph nodes. So, move your hair out the way real quick. Okay, so we've got your preauricle, which is right here in front of the ear. And then we've got your subauricle. And then I'm gonna turn you just a little bit. We've got your occipital. We've got your tonsil. Then we've got your mandibular, your submental, and then we've got your superficial clavicular, your deep clavicular, your subclavicular, and then if you'll shrug your shoulders for me, got your supraclavicular. Okay, and you can go ahead and relax your shoulders. And now I'm just gonna check your thyroid. So if you'll tilt your head to the side and swallow, and then the other way and swallow. Okay, and that completes our assessment. I am giving report of a patient who presented today for a general survey and inspection of the head and neck. She is a 21-year-old female who presented awake, alert, and oriented ×3. She does have access to 3 meals a day, and her BMI was within range for her height and weight. She seemed to be in a good mood upon presentation. She had a very straight and steady gait. No assistive devices were needed for ambulation. She was in a good mood upon presentation as well. Her posture was nice and straight, and she had good hygiene as well upon presentation. After the general survey questions, we moved on to the inspection of the head, also known as the cranium. We first palpated the head to check for any lumps, bumps, and bruises, which were not present. We also inspected the head for any lesions or infestations, which were not noted as well. We did move to the eyes. The eyebrows, eyelids, and eyelashes
all presented symmetrical and did not have any redness, drainage, or swelling. I should have examined the pupils for the pupillary reflex along with accommodation. I did miss that. Upon further inspection of the nose, it is midline on the face with no redness, drainage, or swelling, and the lips are also symmetrical and midline on the face with no redness, drainage, or swelling or drooping. Moving forward, we inspected the ears. There was no redness, drainage, or swelling with and no pain with palpation. We also palpated the frontal sinus and maxillary sinus, which presented with no pain. Next, we moved on to the trachea. It was midline with no pain upon palpation. We did check all 10 lymph nodes, which were palpable with no pain presented. And then furthermore, we checked the thyroid, which was also no pain upon palpation.